everything.
Okay, so are you ready? Yeah. So we have our article. You have found some articles. So now we are going to talk about the critical appraisal. First of all, I would like to start explaining why it's important the critical appraisal, because it's true that the articles that usually you find, they are published, but the mere fact that it's published is not synonymous that it has a validity, this study. It's true that I don't know how many reviewers are in this room. Are there any reviewers? Yeah, there are some. Okay, it's true that I am a reviewer. I sometimes review some articles, but being a reviewer doesn't make us an expert in methods, for example. For me, my research areas, they are about wish to die, palliative sedation, and suffering. So when I have to review an article, I just accept the articles that talk about this subject, but I spend a lot of hours trying to make all the best, but sometimes I have doubts, for example, with the methodological section. So I explained that because it's true that the reviewers, we do like the first review of the article, the first critical appraisal, we give our comments and so on, and then it is needed that you also be critic with the article, because the articles that we read in the journals, they can condition our clinical practice and also the health projects that we develop, no? Because so they are like a pillar for the health of the society, and also if we don't apply this critical appraisal on the articles, we can sometimes harm patients. So we must be cautious in accepting what is published. What is critical appraisal? This is the definition. It's the process of evaluating and interpreting the literature, considering the results, their validity, and their relevance. We will go more in depth in this. So the critical reading offer us the opportunity to take a position on what the text says, to discover the implicit assumptions. We talked about it yesterday with Daniela, the strengths, the weaknesses of the study, and also to propose other approaches beyond what the author said. The objectives, they are, as I said, identify the strengths and the weaknesses, recognize reliable scientific publications, so we can use the results we can use with our patients, make enlightened decisions and not like decisions with intuition or traditionally it is done this one with this kind of patients. And also, I think that another objective of the critical appraisal must be to share with other health professionals what we have read and what is relevant of the study. So these are like the components of the critical appraisal. They are like the interpretation of what we read, the judgment to differentiate what is valid and relevant, and also make proposal of alternatives to improve the article. So, why critical appraisal? Because reading critically, as I said before, help us to make evidence-based decisions. Also, it helps us to be updated. I don't know if it is feasible to read 20 articles per day, but it helps us to be updated. Also, it helps us to improve our understanding of the scientific literature. Also, when we design another study, we also read what has been done So we can we can apply the knowledge that we have already, that already has been published in the future studies that we are designing, and also we contribute to the development of scientific literature. General recommendations. I will start with this general recommendation, and we will go more into. But it's important to take note of any comments or doubts that we have when we read the article. Consult these doubts, and if we consult them to an expert, it will be better. Also, as I mentioned before, it is advisable to form small groups and discuss the articles. For example, RESPACC has presented the use of journal clubs, and when I was preparing this presentation, I was thinking again, and I was being aware how important they are in our formation, because sometimes when we read in a multidisciplinary team an article, I can notice something, but the other colleague can notice another thing. So we learn from each other, and from the other's view also. Then this is, for me, it's a very important point. Do not worry if you don't understand every word of the article. For me, sometimes I start reading it in English and I say, oh my God, I don't understand nothing at all. So I get anxious. So do not worry. We don't have to understand every word. And do not worry if we don't understand in the first reading all the article, all the parts of the article. We will start, it's okay, we start understanding some, the main ideas, what's it about, this article. I will give you here 6 recommended steps to read an article, general ones. So the first one is to do a quick review of the article. Read the name of the authors, the institutions where they belong, the year of the article. Is it new, this article? The journal. Sometimes my colleagues, they will talk later about it, what's the quality of this journal. Then interpret the title of the article, see if it is well divided in sections, look the graphics, keep a couple of minutes looking the graphics, the tables, are they illustrative? Do we understand more or less what this look about? And also go to the bibliography section, the reference section, and see if the references, they are recent. Recent is about 5-10 years old, more or less, and related to the topic. Then we will read the abstract of the article, and this is a very important point, because in this point we talk about that we have 50 articles, or 90, I don't know how much it was, but 90 articles, and we are not going to start reading all of them in full text. We're going to start reading them in the abstract. So read the abstract, try to understand it as much as possible, identify the central argument of the article, and read the conclusions. I will explain later on which section must the abstract have to make a decision, to think if, okay, I follow reading this article, or maybe this article is not that good, so I will go to another one. The third step is to give a quick first reading. So in this quick first reading, we will mark all those terms that we don't understand. And after that, we will reflect on what we have understood and those questions, those doubts that we have in that moment after reading this quick first reading. Later, the fourth step is to look for those words that we don't understand and that we think they are fundamental to understand the study. And it is the main ideas of the article. No, we were, I don't know, maybe we were talking about refractory symptoms or refractory palliative sedation and refractory symptoms. So imagine that I am reading refractory and I don't know what it is. No? So I will look what is refractory, what is talking about. No? So the fifth step is to read the article in a second time, and this time we will read the article carefully and also being familiar. No, we have already looked for those terms that we don't know. Here again, take note if any question arises, summarize the ideas and main conclusions, and also we will try to answer some guiding questions that I will show you now. The guiding questions, these are more a bit general, but we will think about what's the research question. We have already seen it. What's the hypothesis of the study? Which are the objectives of the article? What has been done before about the topic? What method has been used in the research? How we collected data, how they collected data, and how this data was presented, and which are the main conclusions, and do these results, these conclusions contribute to the knowledge that we already have? These are like a general guiding questions. And then, as you see, I mean, it's true that there are like a lot of steps until we can make the critical appraisal. Sometimes I don't know, sometimes I read the articles just twice, and I realize now that I am not doing the proper critical appraisal, maybe, no? So it has like a lot of steps. In the sixth step, we have this critical reflection, so we can see the validity of the of the study. Are we measuring that thing that we want to measure? No, it's a study. It has validity, and we will start analyzing key parts accurately. I have here like some critical questions, but I think that it's better if we start like going more in deep by section. Okay, what we have to find in each section, and what we have to look for, what they have to show us each section. No? So we have to see that if the article is well distributed, the sections are organized. We all know the sections, no? So we will start describing one by one. The title. The title must describe accurately what the study entails. It must have a simple structure. It must be attractive, so we have to choose it. And also it must give information about the sample, no? Palliative patients, elder patients, the characteristic of the group. No, they are pediatric, palliative, end of life, and also the scope of the study. Here you will see, like, after all this presentation, all the presentation of this section, I will put a table, and this is a table where we are going to work later in the material that they brought you yesterday. There is a work table, so in the work table we will follow these items to do the critical appraisal. Okay? So the title, we need to see if it describes accurately, if it is clear, concise. There are no acronyms in the article. Then the authorship. Also, we are going to look at the authorship section because, for example, in the first question, the complexity of the article and the number of articles of the author, is it consistent? For example, if we have a case report, for example, and we put like they are written like 15 authors. Does it make sense? In another hand, for example, we are in a international study about palliative sedation, and we are participating 8 countries in Europe, 8 European countries. Does it make sense? Maybe yes, no? So that's the difference. We have to see what's the method, what's the study, and does it make sense to have that much authors? So we'll follow, we will see if also the researcher, they are specialists in the area of knowledge of the subject area, if they have published other studies related to the topic, and are these studies redundant with what has been published, what we are reading. No? We have to check also that. The abstract. The abstract, as I have told you before, is it's a point that we have to make a decision. Are we going to read the article, full text, or are we going to another article? So this is like an abbreviated expression of the study, of the most important ideas and the concepts that the article has. It's like a business card to the reader. Like this is like my presentation. So here is the study. So there we decide, okay, I will read you, or no, this is not interest for me, or I think that's not well done. It must be independent, self-explanatory, and also autonomous. And the purpose is to identify the content of the article quickly and accurately. Depends of the word's length depends, but it's very important that it must be precise, concise, simple, and clear. We know that the abstract usually have this structure, the rationale, the main objective of the study. They talk about the methodology, what's the study design or the type of study, what's the place, time, setting, the context in that this study has been conducted, which are the participants in the study, which interventions we apply, and how are we going to analyze this data. And also they give like the main results, but they are very precise. And for example, in quantitative study, they should give numerical values accompanying these results. And finally, we will it has the conclusions part. So this is the work table that we are going to be working with. So we are going to see now the introduction. The introduction is somehow the part of the article that helps the reader to familiarize with this with the subject. For example, if I am writing an article about or reading an article about existential suffering, it may explain what is existential suffering, and it may give the reader this important information about what we are going to talk about. That's why it describes the elements of the conceptual phase and the basic concepts that they have already been published, and it serves as a transition between the authors and the readers' work. Yeah? It answers to what and why of the research, and the abstract should cut like the reader. No, it's should arouse the reader interest. This is the structure that the introduction should have. We list the general issues, like the theoretical framework of the subject. We review the background of the problem. We define the research problem. No, what's our questions? Then we write which variables are we going to consider in relation to this problem, and then it must end with the formulation of the objective of the study. So So in this case, I will just say that the objective needs to be precise and well written and specific, and the objective must respond to the research question that the authors have. Okay, so this is about the reaction style, but I mean, I think that I have mentioned most of these things, and then the references of the introduction, because in the introduction there are written references because they give this theoretical framework. We have to check if they are relevant to the topic, if they are updated, and also if they sufficiently support doing this research. Yeah, because maybe sometimes it is already published and we have an objective, and other people, they have already answer to this question, so it doesn't make sense. No? So does it support what we are doing? Or for example, in the article that we are going to work, it is about applying an intervention, but the authors, they have previously done like a feasibility study to see if it is possible to do this kind of intervention. So maybe this supports now doing the intervention. Oh, yeah. Okay. Then the method section. This is very important, and it's true that I mean, I have a little bit of knowledge, but I don't have all the knowledge about methods. And sometimes to have a partner, to have a colleague who knows about methodology, or when we don't know, so we can ask, is very important, because if we see that a study is conducted with a method that is not valid, that's all. No? So this is a very important section. It must to be adequate for the research question, accurate. Also in quantitative studies, it must have this power to detect real differences. No, maybe if we are going to compare two interventions, but the sample size, if just 15 patients, maybe we don't have the power to identify any significant or real differences. Real differences. So here in the methods structure, they must describe what's the type of design, what sample it's included, how we collect the data. No? Yesterday, Sheila talked about the recipe in methodology. So this is more about, it's kind of a recipe, no? The method section must show how we have done the cake. So you can take the recipe and you can do the cake in Romania. No? So this is about that more or less, yeah. In this section, we need to describe the intervention, the instruments, the measurement procedures, also define the variables that we're going to study, and how are we going to study with the instruments, and how we are going to do the data analysis. I put this slide because it was important to remember that we are working with palliative care patients, and it's true that this sample, our patients, they have like very specific characteristics. So this is important to remain, because we take care of patients who have fragility, who have limited life expectancy, also who have impairment in higher functions such as cognitive function. So when you read an article that is conducted in palliative sample, I think that we need to have in mind this patient and see, okay, this intervention, for example, was done to this patient, and how that is key. No, for example, I conducted a study with patients with wish to die, and I need to fulfill some questionnaires with them, and there were like 5 questionnaires or so, and that was a lot for a patient in palliative care. So what we decide, okay, so let's see, and let's do like maybe 2 questionnaires one day and 3 in another day, or something like that. Like we have to be rigorous, but also we have to have in mind what's our sample. Yeah? So that's why I put this slide. And then, for example, with the life expectancy, sometimes if we conduct, if we want to follow up the patients, sometimes they will die. So we will lose some patients. So that's why I think that we have a very special sample. Yeah. This we will see it later. About the results, the results section should inform about what was found in the research, what were the main findings, also, the results section needs to have like a description of the study population, need to describe the population, and it must be very clear to understand by the reader. The results section, they can have like this text where results are written, but also there are textual aids like tables, figures, images, and so on. So I have said that the results section, when we read an article, we need to check if it is clear, if it is precise, if it use like appropriate paragraphs, headings, subheadings. No, do we read it like easily, taking into account that sometimes the results, I mean, they are a difficult section, no? But do we read it easily? Yeah. And then about the tables and the figures, are they self-explanatory, simple to understand? That's very important. Short, with a clear title, indicates, no, they must have an explanation about what's the scale used to measure that variable, how is that scale understood also, and they should have like this balance with simplicity and clarity and functionality. And that's important, that they must add information, not duplicate. We are not saying the same in the text and we are like the text and the tables, they are complementary, but we are not duplicating the same information. That's another thing that we have to check. The discussion. So the discussion section must show what's the significance of the study findings, highlight also like the new and relevant aspects of the study and the main conclusions. This is the part that we are going to analyze the data and also interpret the data. In the results section, they shouldn't have interpreted the data. And the discussion section must provide a concrete answer to the research question. So this is more or less the structure that it should have. So they should be commenting their own results. They should corroborate the reliability and the validity of the research. They should compare the research that have been done before, and they have like similar data, or maybe they have found different results. So they should compare. And also, this section must acknowledge the limitation of the studies, no? And the author should have been criticizing their study honestly. And then this section also need to discuss the theoretical and practical implications that we have found of within the study, and suggest further studies or hypotheses. So the conclusion section will go here. So needs to answer the research question. Sometimes you will see that there are some conclusions that they are not related with the objectives. This is a very common error. So they have to answer the objective, and that's it. So another part of the article, there is the reference section, and we need to check that it's presented in the journal standard style, Vancouver, APA, whatever, but they are correctly written. Are recent, the article, the references used. For example, you will see in the article that we are going to work that they are quite new, but there are some references that they are referring to, for example, instruments that have been developed before and they are using, so that makes sense, even if it is from 1982, I don't know, but because they are using that instrument, no? So we need to see if the references are relevant and are logical, I mean. Then ethical issues. Does the study need any ethical consideration? Do they have it? Has informed consent been obtained from patients also? And also, that attention should be paid to any declared conflict of interest or grant. Yeah? This is another section that should appear in the article. So I think that I have told all of these, no, were written, adequate, precise, simple, clear. Yeah. So this is like what I have shown you is like a general critical appraisal for every article. But it's true that there are some specific guides depending on the method. I am not going to explain that because my colleague Maria later on she will explain one kind of guide of this, but it will be nice if you check the critical appraisal skill program where you can find the CASP, where you can find how to, like a guide to make the critical appraisal of a specific method for the article. Yeah. So we'll do an exercise that this is, I think, that's the best way to learn. So you have the article called Temel of Temel. I know that this article is from 2010, but I think that is a really good article. I mean, the results, they are really nice, and that means it's a very relevant article for palliative care. So what we are going to do is I want you to read the article. Yeah. Yeah, that's it. Yeah. Early palliative care. Early palliative care for patients with metastatic non-small cell lung cancer. Yeah, I will send it. Yes, yes, okay, that's fine. So, what we are going to do? Okay. Okay, thank you very much. So, what we are going to do is to read the article. First, I will ask you to read it individually. Remember this quick read. No, do you remember these steps? Read individually, then also read it deeply. Okay, we'll have like 30 minutes, so we'll do our best, more or less. Okay, and then in the second or third read, you will follow this guide. You have here a work table, critical reading and evaluation of scientific literature. Have you seen it? Yeah. So I would like if you, in the second or third read, you try to fulfill these items, so they will help you to make the critical appraisal. And then in the last 15-20 minutes, we will try to put it in common and discuss. Okay, so this is like a journal club, more or less, and we will learn it all together. Okay. Yes, sometimes it's true that the answers sometimes is yes, sometimes is no, sometimes is not. It is not described or is not said yes. But more or less, if you write like yes, no, and take some kind of idea, so you can discuss later. Yeah. So we have 30 minutes. The work table, so we'll do it all together, and then I will send you the work table fulfilled, and also in the material section you have another article and another work table. We're not going to do it, but I will send you the results, so if you want to compare at home. Okay, so wait, I have lost the yeah. Okay. Okay, so we will start from the starter. So I need your participation. Okay, so about if it is well distributed, well organized, what do you think? Yeah. Okay. The title. Does it describe accurately what the study entails? Is it clear, concise? Yeah. Okay. For you now, Martina? Okay.
I think the title doesn't talk about the objective of the study.
Yeah, you mean that is it effective? You mean so?
Yes, it says just early palliative care for patients but we don't know if they are looking for if early palliative care is going to be better than. I mean, only with the title.
Okay, you don't know.
I don't know what is going to happen in the article.
Okay, okay. For me, it was clear, but I understand what you mean. I don't know, Maria. What do you think?
We are used to have to put something about the methodology, or if it's a comparison or something in the title. So when we don't have that information, you don't know if it's a descriptive study about what's early intervention and observational one. But here they are comparing two interventions. So having some more information in the title might be helpful.
Okay. So we will now go to them. Okay. So then maybe we can skip the authorship. Have you done it? That section, if the relation consistent with the complexity of the research. Yeah.
Okay, I don't understand. What does this mean? The relationship between the complexity of the article and the number of the author is consistent.
Okay, yes, this is what I have explained before. For example, depending on what the study type, or for example, I will explain you in another way. If you have like a study with a multi-center study, which involved, for example, in this case, different oncologists. No? In this case, it was like that. Maybe it does make sense if the authors, they are 10 or so. But in a case report, for example, you have a case. Sometimes you have in the hospital, no, in your team. So maybe it doesn't make sense if you have like if it seems like you have put in all the team and all the persons, even they haven't participated. Yeah. Okay. You have another question? Excuse me?
Was the study was ongoing from 3 years, and maybe this is the reason for why they have so many authors.
Okay, that's for you. It makes sense, huh? Yeah. So yeah, for me also it makes sense. Then for the answers about if the researchers, they were specialists in the area, we see that in institutions they work with palliative medicine, and also just checking the references between the references in the article, we can see that these authors, they have already published some other studies about the integrated palliative care in advanced non-small cell lung cancer, early intervention palliative care, patient with metastatic cancer, advanced non-small cell lung cancer. So we can see that they have this background in the subject. And there was another question about the redundant publications. And it's true that if we check the reference 15, we can see that they talk about the early intervention in outpatients with palliative care in this profile of patients, but we see that they study the components of the early intervention and not the effect. So it's not redundant with this. So we'll go to the abstract. What do you say? Can someone answer, like briefly? Don't be shy, we are learning together. Okay, Maria.
I think the abstract is very clear, very well structured. At least it helps me because they are subheadings. So having the background, methods, results, and conclusion, it gives me more information and a better grasp of the whole article.
Yeah, and also there is like this justification of the research, the objectives, sample methods. Yeah, it's very precise, this article, and also, as we have said before, the quantitative results, they are accompanied with the numerical values also. So it's a well done. It's well done. Introduction. Can someone say something about introduction? I will ask. Do they summarize the current state of knowledge? Yeah. Okay. Yes. Do they clearly reflect what is known and the gaps that they are? Yeah. Do they explain the study, the objectives, and the objectives? Yeah. And does it clearly identify the objectives and the hypothesis of the, there's a section that it's clearly, okay. So, method section. Do the authors identify the type of study conducted and the sources of their data? No, we can see that they identify that it was a randomized control trial, non-blinded, sorry. Yeah. Do you think that the design is adequate for answering this question? The objective, I mean. Yeah, they compare two groups. Yes. The number of patients according to their objective. Do they justify how many patients and they are going to include and what's the power of the study? Yeah, no, they justify it. And they explain the variables studied and the measures in this section. Okay. So we have more questions in this method. Okay, good.
Hello.
Yes.
I'll have a question. They said they have this paragraph on patients after the study design, and then on the statistical analysis, they are saying that they allowed to enroll additional patients.
Yeah.
And my question is, it wouldn't have been, I know, better to put this section, this phrase in the patient headline? I don't know why do they choose it's in the statistical analysis
To
the protocol.
add, you mean?
They had, yes, this phrase. Why did they choose to put it in the statistical analysis? The fact that the protocol was amended and they enrolled additional patients.
Mm-hmm. I understand what you ask. I think that because it was something new added, so that's why they put in a different part of the research.
Okay.
Yeah,
Because I if I would have written this, maybe I would have thought that I wanted to enroll 150, but because of some problems, the protocol was amended, and I'll have to include some more patients, and I would have put this in the patient subgroup.
Okay. Yeah. In this case, I think that it was like an exercise of being clear, and because this happens sometimes when you are you plan to do a study, you calculate a power, and then you can in the way that you are doing the study, you can be analyzing the power, and you see I have no data enough, so I can add more patients.
Okay.
So I think that
this is why okay, I got
yes,
it.
that's it. It's like a clarity exercise. Yeah.
And I think they also said that sometimes they didn't manage to have all the full details of the participants. So they enroll additional participants to compensate the loss of any patients. So it was a way of being sure that they got the enough number of participants based on the power calculation they did.
That's it. Yeah. Okay, so so I have we will go. There is, for example, in the results, do you think that they are clearly expressed? Yeah, I think that they are clearly expressed, even it is like a bit complex to, I mean, you have to read more than one time, 2, 3, 4 times to understand everything, but I think that it's not because they don't explain it properly, just because the nature of the complexity of the study. So, okay, results. Okay, do you think that they follow a logical and parallel like order? Yes, I think that they are well ordered. They also, authors, they explain the evidence of missing data. They also mention if they have lost patients or not. The sample is well described in table 1. Okay, I think that, I don't know, have you read this section or? Yeah, okay, so are the comparison justified? What do you think? The way they compare the groups? It's, yeah, no, it's the aim of the study. Are the tables and figures necessary? Did it help you? Yeah, no? Okay. Self-explanatory. Someone said they were very nice, so I think that they are self-explanatory. They are not repeated, and it's true that the results section is very precise, and it hasn't got any interpretation. Like these are the results. The dates of collecting data are defined, but they are defined in the methodological section. That's true. So we're going to the discussion section, and yeah, okay, we are finishing now. So do they discuss the results in the section? Have you read this section? No. Okay. So yes, I put yes. The conclusions they have, yes, the answers to the research questions that they have, like patient report outcomes. They talk here about the improved mood, improved mood, quality of life. So yes, the discussion section is quite well written. Here I will correct. I put here there are hypotheses generated, but I put no, but I have realized there is one, so you will check. And also they mention the limitation of the study. They talk about they did it in a single hospital, that there was a lack of diversity in the sample, that the patients were aware of the study achievement. And then, okay, then it's true that there is a conclusion section. And for me, I was discussing it this morning with Maria that it was weird for me. I have never seen it that in the discussion section, in the conclusion section, it compares the effects on survival and quality of life that are similar to the effects of first-line chemotherapy in such patients. It compares with the other studies. I don't know if you, Daniela, if you have seen this. For me, it was new to see in the conclusion like a comparison with other studies. Have you seen it before? Not really, no?
What I'm thinking is that I'm thinking not with my head of a researcher for this study, but I'm thinking with my head as an oncologist. I think this if I'm going and reading conclusions, because that's what you're saying, I think this would really say, wow, I need to read this article. Yeah. So I think strategically it's very strong.
Yeah, that's what we have concluded, that this is to attract some people who to palliative care also. Yes. So if it is okay for you, we will leave here, and I will send these ones, and I will also send, as I told you before, another article that you have there, and also the analysis, so you can compare, and also you have our email, so if you need. Okay, thank you.